Welcome back to the Graybeard Medicare channel. Corey here, and Joe's with me as well. Let's get right into this. If you are a veteran or military retiree approaching age 65, don't just assume that Medicare enrollment is going to simply take care of you all on its own. That assumption could leave you with a coverage gap, a Part B late enrollment penalty, or even a problem with your TRICARE coverage. And here's where it gets confusing. VA healthcare, TRICARE for Life, Medicare, Medicare Advantage are not all the same thing. They are healthcare, but not the same thing. They can work alongside one another, but they follow completely different rules. So today, Joe will separate these rules. He's going to explain the Medicare options for veterans, for military retirees, and what may be available for you. Okay? Joe, before we get started, give us the short version. What's the biggest mistake that people make?
Yep, and good afternoon, folks. The biggest mistake is believing military service, VA benefits, work credits, or TRICARE will automatically enroll you in Medicare at 65. Sometimes enrollment is automatic, sometimes it is not. You need to know which group you're in before your 65th birthday. This is general educational information. Your options depend on your eligibility, location, and plan. Verify your situation before changing coverage.
All right. When does the Medicare enrollment actually happen automatically?
Automatic enrollment into Medicare Parts A and Part B generally happens when you're already receiving Social Security retirement or disability benefits or railroad retirement benefits at least 4 months before you turn 65. But here's the important part. Having enough Social Security work credits is not the same as receiving Social Security benefits. You may have enough credits for premium-free Part A, but if you delay Social Security retirement benefits beyond 65, Medicare may not enroll you automatically. In that situation, you must actively apply through the Social Security Administration.
A person can qualify for Medicare, but still not be automatically enrolled?
Eligibility and automatic enrollment are two different things. Your initial enrollment period, we refer to that as IEP, normally lasts 7 months. 3 months before your birthday month, and 3 months afterwards. Waiting can delay coverage. Military retirees who need TRICARE for Life should act early. TRICARE recommends enrolling in Parts A and B at least 2 months before turning 65.
And what happens if someone thinks, hey, I already have VA, so I don't really need the Part B?
Well, that decision needs to be made carefully. VA health benefits are valuable, but VA health care is not treated the same as active employer group coverage for Medicare Part B enrollment purposes. If a veteran delays Part B, that person may face a penalty and may have to wait for enrollment periods. The standard penalty is generally an extra 10% for each 12-month period the person could have had Part B but did not enroll, unless a special enrollment period applies. For a military retiree, the stakes can be even higher. The TRICARE for Life generally requires both Medicare Part A and B. If you delay Part B, you can lose TRICARE coverage until Part B becomes effective.
The safe message is not everybody must make the same choice. The safe message is don't ignore the deadline, right?
Correct. That's very true. If you or your spouse are still working with active employer coverage, different rules may apply. Coordinate with your Social Security, the employer, and TRICARE before delaying anything.
So then let's separate the veterans who use VA healthcare from the military retirees who have TRICARE for Life. How does Medicare work with VA benefits?
Medicare and the VA are two separate systems. They generally do not pay for the same service. For VA authorized care, the VA pays under VA rules. For Medicare covered care from a Medicare provider outside the VA, Medicare pays under the Medicare rules. Medicare can provide access to civilian doctors and hospitals, but Medicare does not pay for care inside a VA facility, and the VA generally does not pay for outside care unless it authorized it.
Okay. Because I know when my dad was signing up for Medicare Advantage, and he's a veteran of the Air Force, this was the big question. Medicare doesn't replace VA benefits. Is that true?
No, many veterans keep both because each system provides a different door to care. VA prescription coverage is generally creditable drug coverage. It may allow a veteran to delay Part D without a Part D penalty while VA drug coverage remains in place. But Part D rules are separate from Part B rules.
Okay. And what types of Medicare plans can the veterans actually qualify for? Is that different or is that the same? Tell us all about that one.
Okay. If a veteran has Medicare Part A and B and lives in a plan's service area, that person may be able to enroll in a Medicare Advantage plan, also called Part C. There are three broad categories worth discussing on that, Corey. First, regular Medicare Advantage plans. These provide Part A and Part B coverage through a Medicare-approved private insurer. Depending on the plan, they may include dental, vision, hearing, fitness, transportation, or an over-the-counter allowance also. Second, chronic condition special needs plans, or C-SNPs. They serve people with specific severe or disabling conditions, which may include diabetes, certain cardiovascular conditions, or chronic heart failure. The condition must meet the plan's requirements, must be verified, and the C-SNP must be offered in that county. Third, dual eligible special needs plans, or D-SNPs, serve people with both Medicare and Medicaid. They coordinate benefits and may offer added care coordination or supplemental benefits.
Yeah, SNP, we've dealt with that a lot before. Before we get too much farther, I know there's a lot of information here, and I want to give people the option. So you can scroll on down in our description. There's a link to connect with us, ask us more questions. If you have anything else more in depth you want to get into that you need to ask us about, go ahead and scroll down and click on the like while you're down there and the subscribe. Click on the scheduling link and we'll reach out to you and help you out with all of this. This is where people hear about the food cards and no copay plans. Is that a guaranteed thing as well?
No, that needs to be explained accurately. Some plans may offer grocery, healthy food, meal, utility, or over the counter benefits. They are not in every plan, and not every member qualifies. Eligibility may depend on the county Medicaid status, a chronic condition, or other plan rules. Amounts, stores, approved items, and rollover rules vary. The same applies to $0 copays. Some D-SNP plans or members with full Medicaid may have little or no cost sharing for many services, but it depends upon Medicaid status, the plan, the service, and the provider. The right question is not, does this plan advertise a food card? The right question is, am I personally eligible for that benefit? And does the plan work for my doctor's prescriptions and other coverage?
Okay, now let's move on and talk a little bit more specifically about military retirees. What about TRICARE for Life? How does that fit in with Medicare and with all our Medicare plans?
Right, Corey. For most TRICARE eligible retirees entitled to premium free Part A, both Part A and Part B are required for TRICARE for Life. With original Medicare, TRICARE for Life, Medicare generally pays first and TRICARE pays second for covered services. Many claims cross over automatically. Military retirees may also enroll in Medicare Advantage. Some areas offer MA only plans without Part D. Those can be worth reviewing because TRICARE includes pharmacy coverage. An MA only plan may add dental, vision, hearing, fitness, or over the counter lines without adding Part D. But we need to be careful with the phrase, it does not interfere with TRICARE. TRICARE for Life does not disappear when you join a Medicare Advantage plan. Medicare remains primary and TFL remains secondary for TRICARE covered services, but how you receive care can change.
And just to clarify, when you refer to MA, that means Medicare Advantage, right?
Correct.
Good. And then, so what actually changes in this Medicare Advantage and TRICARE situation?
Original Medicare with TFL generally offers broad access to Medicare participating providers. Medicare Advantage may require its network referrals, prior authorization, and copays at the time of service. Medicare Advantage claims do not automatically cross over to TRICARE. You may need to file a claim for reimbursement of TRICARE covered copayments. A $0 copay cannot be promised across the board. Confirm it in the plan's evidence of coverage document and verify the doctor is in network.
I know we kind of hinted at it a minute or so ago about the prescriptions and the Part D. Let's get more in depth in that. Talk to us about what the prescription coverages are going to be there.
All right. TRICARE for Life includes TRICARE pharmacy coverage, so military retirees do not need Part D just to keep TRICARE for Life. Some Medicare Advantage plans include Part D, and they may coordinate with TRICARE when the pharmacy participates in both networks. Other plans exclude Part D. The best choice depends on prescription pharmacies and plan rules. Never change drug coverage without checking how it coordinates with TRICARE.
And if someone is comparing these plans, what should be the first question on their mind? What should that person ask?
I would ask several questions. First, do I have VA healthcare, TRICARE for Life, Medicaid, employer coverage, or some combination of these? Secondly, are my doctors, specialist hospitals, and pharmacies in the plan network? Also, are my prescription medications covered and which coverage pays first? Will I need referrals or prior authorizations for the care I use? Another, what will I actually pay in premiums, copays, deductibles, and maximum out-of-pocket costs? Do I personally qualify for the advertised dental, food, utility, transportation, and over-the-counter benefits? If I have TRICARE for Life, am I comfortable filing claims when Medicare Advantage claims do not automatically cross over? That's a list that you can consider and much more useful than choosing a plan because of one benefit in a television commercial.
Good point. I like that seventh question, because everybody thinks it's all government. The right hand should know what the left hand is doing, but they are separate entities in the government, so they don't always cross over automatically. That list is a lot more useful, like you said, because what you see on the TV, just one benefit that's being highlighted on a commercial.
Right. And extra benefits is only available if the full plan works for you.
Let's leave everyone with one main takeaway, something from this video. What do you think?
If you're a veteran or military retiree approaching 65, find out now whether Medicare enrollment will be automatic. If you're not receiving Social Security or Railroad Retirement Board benefits at least 4 months before 65, do not assume a Medicare card will arrive. Contact your Social Security department. If you are TRICARE eligible, make sure you understand the Part A and Part B requirements before your 65th birthday. Before choosing Medicare Advantage, compare the network prescriptions, authorization rules, claim processes, total cost, and eligibility for extra benefits.
If this video helped you, go ahead and share it with a veteran, with a military retiree, spouse, or caregiver who needs this information, because it can seem quite confusing. If you need help with it, let us know. And if you want help reviewing Medicare options available for you in your area, just reach out. And the link is down in the description here. We can help you compare all those choices based on your doctors, your meds, your prescriptions, your military benefits, and personal priorities. Don't wait till the last minute. Medicare, one missed deadline can affect your coverage and your costs for years to come. Joe, any wise words?
What you just said is really sage advice, Corey. You do not want to have a penalty that might, or a lack of coverage that might cost you for years. We can help you, and we thank you for listening, and we also thank you very much for your service, and take care.